The doctor came in at the end and said, so like baby A has an omphalocele. And, you know, like after that, you're not saying anymore like, oh my God, I can't believe there's two. It's like, oh my God, there's something else.
The Complex Fetal Care Center at Penn State is unique for a lot of reasons, and we have patients come from other centers, other referrals. And so and it's always, scary and frustrating and, a little unnerving to be told that there might be something wrong with your baby, especially for really any couple, but for a couple who has gone through, having to do artificial reproductive technology, just really all the things they have to do to get pregnant. And then to have the miracle of having twins.
Dr. Pauli is amazing.
She's
incredible.
She's why we were at Hershey.
Yeah, she was very upfront and was like, of course, we're gonna hope for the best situation possible, but I wouldn't be doing my job if I wouldn't, tell you these are the realistic options and we can't write off these certain conditions.
And that's when we were like, okay, we wanna go with Hershey.
An omphalocele is a major birth defect. Any baby that has any sort of birth defect is at increased risk for certain genetic conditions. Charlie does have Beckwith-Wiedemann syndrome. Chris went into preterm labor and had the babies a little early and had a C-section. She also, by that point, had been diagnosed with what's called gestational hypertension. And Chris wasn't feeling well, so Ally brought her back, and as it turns out, she had preeclampsia.
One of the residents in the NICU was like, I just saw your wife got readmitted. Is everything okay? And I was like, no, this is where we're at. She's like, oh my goodness, well, please no, we'll keep you updated with surgery. So every half hour, 45 minutes, they actually reported, they called me. She had no idea this was happening, that they called me to give me an update about surgery, and surgery went really well, which was one big relief. And then I came back to the room and Chris was getting a blood transfusion and was going on magnesium. I think that was my moment of relief, where it was just like, okay, they're both gonna be okay.
She was in the NICU until a day after a month old.
Babies with Beckwith-Wiedemann can have a tongue that just always seems to be sticking out. And that gets in the way, sometimes of breathing, not usually, but oftentimes it gets in the way of eating. So providing nutrition can be difficult. And in fact, that was, after her surgery, that was one of the main issues that kept Charlie in the hospital. She wasn't ready to go home until we could figure out how to keep her safely and adequately fed at home.
You got it. I think one of the things that we appreciated was you kept saying it's not just about the babies, it was about all of us.
Right.
And I think that was a piece of it, because especially knowing the complications at the time when we found out about the omphalocele, we had no reason to think that the complications they ended up having were gonna, be part of our story.
The Devine family was really a success story for us. They came to us at a time when they were very uncertain and concerned and worried about their baby. And we were able to walk through that process with them and help them with diagnosis, help them with care, help them get these babies here safely, and also take care of Chris and the rest of their family to make sure that, they had this is a absolutely monumental time in their lives. And I think that we were able to be with them every step of the way.